HIPcast is brought to you by Enterprise Social Record. Today's episode is brought to you by Solarity. 80% of healthcare data is underutilized. Solarity is changing that. Our intelligent automation engine quickly and accurately identifies and analyzes all patient data, no matter its source or format. The result? Faster, more informed clinical decisions for physicians and better outcomes for patients. Solarity continues to revolutionize healthcare delivery, mitigate cost, and improve patient outcomes. Identify, validate, and abstract data from any source with Solarity. Visit them at solarityhealth.com to learn more.
Well, hello. Today we have a really important conversation. So thank you for joining us on HIPcast, Rebecca.
Thank you for having me.
Absolutely. So many of you may know Rebecca, Dr. Rebecca Reynolds. And if you've been a student in the state of Tennessee, you almost certainly know her. And I'll read her bio in just a few minutes. But what is so exciting about today is we're talking about taking charge and moving ourselves into K through 12 education. And Dr. Reynolds, Rebecca has discovered an article with some very important information that kind of lends itself to health information profession leading in this space. And so I'm excited to explore this with you today, Rebecca, because it's incredibly fun. And for those of you who don't know, Seth and I know Rebecca very well. In fact, Seth was a student of Rebecca's, and we have served with Rebecca for many years, and she's been leading educational things and volunteer service in our state for a long time. So I feel like I could give your bio, but I'm going to miss stuff because I don't think anyone can keep up with what all of you have accomplished. So I am going to read your bio. So, and she is Dr. Rebecca Reynolds. As a friend, it's almost impossible for me to call them by their appropriate name past an introduction, just because we are so close because of volunteerism.
Yeah.
So I'm going to read this, but Rebecca Reynolds, Dr. Rebecca Reynolds is a doctor of education, has a master's in healthcare administration. She's an RHIA and a fellow of AHIMA. She's a professor and program director for the Health Informatics and Information Management program at the University of Tennessee Health Science Center. She has been teaching for over 25 years, and she has taught at the baccalaureate, master's, and doctoral level. She's an active member of the American Health Information Management Association and has received the AHIMA Legacy Award in 2010, and she's been a fellow of AHIMA since 2012. She served on the AHIMA Education Strategy Committee, Nominating Committee, as a delegate and a state president, and was elected as a commissioner on the Commission on Health Informatics and Information, what we call CHIM. Mm-hmm. She coordinated the HIPAA implementation program for the UT Health Science Center system and provides HIPAA privacy and security expertise on campus. She's the co-editor and author of Fundamental of Law for Health Informatics and Information Management, which is in its 4th edition. And she is currently a program director on the NIH-funded project From High School to Healthcare Lab and Data Science Pathways for Success. This program provides educational opportunities for students in high school to learn about data science careers, and she also researches future HIM workforce needs. Rebecca, thank you so much for especially that last part. The work you're doing with high school students, the important research you're doing, the pathways that you constantly pay attention to and look toward. Thank you for being here to talk about this.
Yeah, thanks for having me.
Yeah.
So I'm going to struggle with the Rebecca Dr. Reynolds things, as I always do, because you were Professor Dr. Reynolds for me. So at our state meeting, I'd say, "Hey, Rebecca," and I'm like, I can't say that.
Yes, you can. Yes, you can. Yes,
I always struggle with that, so that's all right. But as Shannon mentioned, this is a fascinating conversation because I think it's something that our industry, our profession has struggled with over the past few years, is recruiting students into our certificate programs, our associate level programs, baccalaureate, all the way up to the master's. And those programs are starting to struggle. I've heard from other programs across the country, or at least other component state association leaders of their education programs are having a difficult time recruiting students into the field. This conversation came from a conversation at our annual meeting of a conference that you attended, and how it seems like K through 12, especially the science world, is moving towards data science. That's where we fit in. It's a perfect opportunity for our profession to lean into helping the K through 12 students and teachers in the data science world, explain to them what a health information is, explain to them what the health information profession is, and ultimately create a funnel for our colleges and universities all across the U.S. But we will get really deep into that very quickly. But one of the questions we always like to ask, because it's a fascinating thing to hear people's story, is to tell us about your HI journey. How did you find the HI profession, and how did you make it to where you are today?
Good. It seems like it's everybody's story, right? Because I've listened to your previous podcast and had numerous students come through various channels, but I grew up wanting to be a horse trainer. I grew up riding horses, and I wanted to be a horse trainer and a horse vet, and my dad was like, well, that's going to be really challenging. There's not many people who make a living riding horses. So maybe you should think of something else. So my dad was a pharmacist, and in a small town, locally owned drugstore back in the old days. And when I figured out the pills were in alphabetical order on the shelves, I'm like, I could do this job, right? And so I went to college, and first semester made a C in chemistry and a C in physics. And my dad said, maybe pharmacy school's not where you're going to end up.
Have you considered horses?
Yeah, like maybe this isn't it. And so actually my advisor, I was at Middle Tennessee State, and my advisor like pulled out the pamphlet, right, of OT, PT, all the stuff. And medical records was on the list. And many of you know Janet Jacks, oh my gosh, I can't believe it. Janet Jones. And so she was at Middle Tennessee Medical Center then. Back in the day, the hospital at Murfreesboro was pretty small, and it was by campus. And so I went over to see her, and she was a UT graduate. She's from my hometown. And anyway, she gave me a job, as many of you, she needed kind of a temp floater kind of person. And so the 3 years I was there, I worked part-time, full-time in the summers, rotating through the various parts of the department. I remember we had one version of Word Perfect. This is in the 80s.
Grief.
Right. Remember those days when you had one version
No.
on the one computer? Seth doesn't, but we're old enough to
Go back to your bed.
remember that. Yeah, like with the one computer. So I remember I got to type the updated approved abbreviation list.
Oh, wow.
Yeah, and I thought I was the star of HIM. But, again, it was that HIM professional who was willing to take a random student, and expose me to the field. And so, then I, came on, and anyway, and then May Mel, who was the longtime chair,
Oh, yeah.
recruited me kind of. I was an adjunct, taught as an adjunct for a number of years, and she was like, come over here, and it just happened. Like so many of us, but I've enjoyed it. I enjoy the teaching aspect, the learning aspect, just reflecting on how much our field has changed is just incredible. And I think it also shows think about all of our professionals who, what you learned in school, those foundations are what allows you to function in this world now, like with AI, for example,
Absolutely.
and so I still teach the legal course, and I still teach a student, we still teach how to correct a paper record. Because if you can understand how to correct a paper record, and maintaining the integrity of that erroneous information, and documenting who made that edit, then you can carry that forward in any system, because I can't teach you how to make an edit in Epic, or how to make an edit in AI, or whatever's coming in the future. But if you understand those foundations, I mean, I think that's how we as HIM professionals have continued to adapt over, wow, all these years since, back in the
Is there still an
early
unapproved
1900s.
abbreviations list in hospitals? Like, I wonder, is that built in the EMR governance for free text approved abbreviations? I hadn't thought about that in years.
It was a very extensive list, and I was I was the sucker, I was
What was the
like,
little book? What did we call that? That little book that we carried everywhere that had all the
yeah,
abbreviations. What was that called?
Oh, I forgot
yeah,
about that.
we put them, in the physician. Yeah, I know. I mean, all that stuff.
Gosh.
Yeah, it's just crazy. I remember when I had to type birth certificates, and we had to type them up on
Oh,
a
yes, I had to do.
typewriter,
Yes.
the long form. And,
Yes.
it's amazing what you learn. I was from a very small town, and Murfreesboro at the time was still small. Murfreesboro was not the Murfreesboro it is now, but it was amazing how much I learned, of interacting with patients, encountering patients who couldn't speak English, encountering patients who were illiterate. We had a birth worksheet we would give them, and I went to pick one back up, and the lady hadn't filled it out, and one of the ladies in the office, I'm like, she won't fill it out. She goes, she probably can't read.
Uh,
And I was
Mm.
like, what? How can you not read? And so I went up there, and she showed me, she said, ma'am, I know you feel, poorly after having your baby. Can we just read this to you and fill it out? And, she did. And so she recognized that. And, it's just amazing that we
wow.
still face a lot of those issues when we're talking about health literacy and data literacy, and some of the stuff we're going to talk about today, that, there are a lot of people who are still at a huge disadvantage when they're trying to access the healthcare system.
Yeah.
So,
I'd say you've had an incredible career and continue to have an incredible career. I'd say you're fairly happy you found health information instead of horse training.
yeah,
You still love horses?
I still love horses. That's one of my goals, is to start riding again as I get hopefully closer to retirement. But yeah, it was one of those things where I think at some point, I mean, I guess some people live out their fantasy, like what their passion is. Like for me, horses, that becomes their career. But a lot of us end up having to find another way to make a day-to-day living. But
Hmm.
yeah, I mean, it's been great. I mean, I've worked with so many wonderful people, and I say I'm lucky because I got involved with THIMA fairly early in my career, and so it's just always been there. The idea of serving in professional service, and I regret the people who don't have that same path. There are a lot of
Yeah.
people who never have the opportunity, and they don't know what they're missing, and they don't know how. I mean, I think about with HIPAA, how, none of us knew what was going on. And we formed a little informal group in Memphis, and then across the state, of people who we would, like this, you would call somebody up and say, oh my gosh, did you hear this? Or how are we going to do this? Or, I mean, and just having that network of people to share with you and invest in you is made a huge difference in my career.
Yeah.
Yeah. So, privacy and security is probably still the number one phone call that we share among our profession. Like, what are you doing in your state, or how are you managing this, whatever. But Rebecca, I want to ask, how did you go from, working at the hospital in Murfreesboro, to leading and educating students? What was your path there?
So, I we were still face to face. I came to Memphis and taught at UT, and not taught, went to school. And, back in those times before Seth remembers, the big job was an HIM director, right? I mean,
Oh yeah,
that was the job.
that
And
was
so
the goal. It was the
I was
echelon.
like, I want to be an HIM director. So I actually took a job at a home health agency out of school. They were just hiring their first credentialed person, and they were going to go for a joint commission accreditation. And so I had the title of supervisor. I think I supervised two people who filed, home health notes, back in the day. but I had the title, right?
Yeah.
And I went through Joint Commission like
Which is a big
immediately
deal.
right out of school. Yeah, yeah. And there were no other accredited at that time home health agencies around. And so um, Kathy Caldwell, yeah, I don't know if y'all remember Kathy, ended up working at Baptist. There was a big home health agency. So many of them went out of business, but she was the only kind of HIM person around. And of course, I think probably Beth and May Melto. Anyway, I reached out to Kathy and she helped me.
It's awesome.
But then from there I went to work at the University Hospital and was an HIM director and worked for our medical group. And so I implemented Meditech back in the day when we didn't have a
Wow.
data repository. Remember those days?
Of
We
course.
created records and then we had to print them all out because we didn't have
Of course.
a repository. And then implemented all scripts with our medical group. And at that time, the UT medical group, anyway, there was a huge loss. Anyway, there was a kind of a dissolution of that. And HIPAA was being implemented. And May Mel, talk about people with vision, was like, she was asked by the chancellor, hey, can't you help us with this HIPAA stuff? And she said, well, I would need some help. And if you could let me hire somebody. So I got hired in the first year. I did
Wow.
HIPAA implementation for the system. So I went around to all the like went to Knoxville, went to the clinics, went to student health and, found out nobody had policies. I mean, just
Mhm.
basic retention. And so I was able to do that and develop the initial HIPAA training. And I still do HIPAA training today. And it's crazy when you stand up in front of a group of students and say, well, yeah, 25 years ago when we implemented HIPAA.
Yeah.
But yeah, I mean, it's crazy
Yeah.
that,
It's been 30
I was
almost,
gonna say
right?
it's
Wasn't it
almost 30 now.
96? Yeah.
well, I'm thinking about from the when we went
From
into
implementing. Yeah.
enforcement. Yeah, in
Yeah.
2002 and 2003 when we went in
Oh,
It's
enforcement.
amazing.
Yeah, and I was pregnant when we were doing the last. One of the physicians that was on our group, who was anyway. It was funny because literally I was waddling around and
oh.
we would be in a meeting later and he would say, Rebecca, how old is your kid? And I'd say 5 or whatever. And he'd say, 5 years ago when we did those, because he said, I remember when we did all this work because you were pregnant at the end of it. So,
That's
but it
funny.
was again, another great experience that someone, I had to do the work, but someone else opened the door and
Yeah.
gave me an
Mhm.
opportunity. And then from there, Maymel had her hooks in me and I went and got my doctorate and she retired and left me kind of here. But I love the education side of it. I love seeing people, I get to see everybody's story, if you will, thinking of the students that come to us and they still come to us in these ways, y'all. I mean, I think that's one of our biggest challenges with recruiting into our field is I always say you can't aspire to be something you've never seen. And so, we've got kids that are in 8th grade in our state picking a path for high school.
Yeah.
And in some of the school, and the thing is, HIM isn't on the list of any of the paths they're picking.
Yeah.
So within STEM is focused at the high school level mostly on engineering
Mhm.
and, you taking calculus 1, 2, and, all the advanced calculus and physics courses. And healthcare in our state is focused more on workforce certificates like
Yeah.
CNA and EMT, which is great. Um, and then when you get into IT, it's focused on web design. There's some web design. There's a little bit of cybersecurity in some of the tracks. And then there's just computer science. So, HIM is not in any of these buckets
Mhm.
as kids are, kind of deciding what they may or may not want to do. And so that's one of the things that through this grant and through the work we're doing is trying to create that option. We're trying to create an option for um, for these students. And so now the National Science Teacher Association has released a white paper on integrating data science through the K-12 education system. So it's like, okay, so we need to use their language,
Yeah.
so and we did that. The reason you mentioned, you read the title of the grant. The reason we when we applied for that grant, the reason we used data science is that the term that the agency was using. So I said, we're data science. And a couple of people went, no, you're health informatics. I said, yeah, that's what we call it. But this is the foundation of what
Yeah.
we are. And so I've just
Absolutely.
started calling it, like in our grant, health data science. We're health data science.
True.
And
Absolutely true.
Mm.
we're even talking about having another getting our bachelor's program reinstated. Actually had a discussion with our dean yesterday. And I said, yeah, we need to be called health data science, because that aligns with what these high school kids are going to come out. But it's not a stretch, because when you look at the domain areas that this
Oh,
white paper
absolutely.
called out, it's creation and maintenance of data, the
Yeah,
the data life cycle. And
that's right.
so we're the data life cycle applied to
Yeah.
health. We're
Mhm.
data visualization with health data. We're privacy and security. And in healthcare, we have different regulations, HIPAA, and other, things that are coming. If the Who knows
Yeah,
what's going to
NIST,
happen with.
NIST related to AI, HCI 1, 2, and 3, TEFCA, if it ever happens, we'll
Yep.
see. I don't know what's going to happen with TEFCA, but Rebecca,
Right.
I
Right.
want to I want to dig into the conference you went to in this paper. But before I do, I want to point out something that you said earlier. You're talking about Janet taking a chance on you, but what you actually said was Janet exposed me to this profession, which means once you're exposed, you can't unsee it, and you just start doing it
Right.
because you realize, oh my gosh,
Yeah.
there's so many pathways here for me to
Mm-hmm.
explore with managing health data. I mean,
Mm-hmm.
release of information, vital statistics, all everything,
Mm-hmm.
right? All the informatics things you can think about, the even the maintenance,
Quality.
the life
I mean,
cycle, governance of it, absolutely quality. So you said exposed. I just thought it was funny when you said that. I kind of laughed inside because I was thinking, yep, once you're exposed, it's like something you can't unsee, which is what happened to all of us on this call and many of our profession, our colleagues. So
Yeah.
it's
yeah,
pretty funny. But let's
yeah.
dive into the conference that you went to, Rebecca. Let's dive into the conference, the Education Science Conference. Let's dive into this this article, this paper that was written, this
Mhm.
white paper, and let's just talk through what is our path forward, what kind of messaging do we have, and then also kind of from an educational perspective versus the marketing that happens at the national level from a HEMA. How do we get those things to be really in sync? So let's just start with your overall thoughts first, and we'll get to that latter
That's-
part if we
you,
can.
you want me to have a crystal ball to
Yeah, I
answer
do. You don't have one?
that that question? I know I've said to some of our marketing people, if you can solve this one, man, you'll be rich, because we've not been able to quite make that leap. But yeah, I think we have to. I mean, this white paper being put out by the National Science Teacher Association is a really big deal for us, because it gives us something that we can immediately. When I read it, I was like, oh my gosh, this is the content I developed, like, for this grant. And this is we're teaching this to these high school teachers. And so the teachers that attended the other thing we've learned is that most of the people who are teaching healthcare or whatever in high school are usually retired nurses.
Mm.
So some of them have not been in a facility in quite a long time. And so they typically so they talk about nursing a lot, right, in these classes. And a lot of them will say, yeah, and there's a chapter on medical records, but that's kind of boring, or that's kind of whatever. And so I'm like, no, it's not boring. And look, we have all this content we've developed for free. Like, that's the other thing that we're doing with this grant, and like I'm doing with teachers. You want me to come to your class and speak in New Jersey? Zoom me in. I can come and be your guest speaker, or I could find somebody. We can try to find somebody in that area, so you can have, because they're like us. If you've got somebody saying, I'll come help you, they'll take that. They'll
Hmm.
take that help, because a lot of them, they don't know. a lot of the high schools have like a survey course where they talk about the different professions. And
Mhm.
so, if they're not passionate about it, they kind of skip over it, so to speak. And
Yeah.
so, but I am hoping that we will see see courses created at the high school level now with data science, and that, like in our state, that there'll be a track. And so, hopefully, that we can be there and be involved. I'm learning some of these people within the state and some of the Department of Education folks, depending on what happens with funding. But if the state gets to control education, we might have more influence than if it
Right.
stays at the national. I don't know, but being able to have curriculum for them to say, okay, here's the curriculum, here's creation and maintenance of data in healthcare.
Mhm.
Here is what the life cycle looks like. Here are the special retention requirements. And then we do a whole thing of, here are the people who do this. Like there's a HIM. There are people that actually are not professionally, but are educated and manage this data because of the risk related to all of these regulations around it. And most people are very surprised. Um,
Is that a dual enrollment type strategy for the high school students to say
yep.
you can earn college credit through this
Hmm.
health data
Hmm.
science course, and
Yep.
our community colleges and even the universities in the state could provide that out into the high school level as dual enrollment? Is that a
Yeah.
possibility?
Yeah. So we actually have a course called Intro to Lab and Data Science that we teach through UT Martin. And so my colleagues in clinical lab, and I, um, have developed content for that course, and we're actually working with a faculty at UT Martin. She's actually a chemistry. She used to work at Vanderbilt in the lab, so she's got some healthcare background and was a researcher, and so. She kind of facilitates that course. But yes, Seth. So we have one 3 credit hour course for dual enrollment that any student can take. And we've got information on our website. If they're interested, they can get that. And we can work with the dual enrollment coordinator to figure out how to work it out with their high school.
So we need to
Um,
market that better as a
yeah.
profession, as a state association. And
Right.
then I'll throw another question at you as we head towards we'll get to the last question here as we start hitting 30 minutes. I knew we would talk. The three of us talking would get through 30 minutes very quickly. But
That's
yeah,
right.
my girls are both in middle school. My oldest is in 7th grade, and she just took a career exam that was
Mm-hmm.
required as one of her courses. And you mentioned that middle schoolers are having to set a track. She had to set a track at the academy she goes to in 7th grade of, is she dual enrollment and what kind of field science or whatnot would
Right.
she do? Now I'm trying to think, all right, we have the dual enrollment side for high school. How do we get to middle school to even influence to say, here's a pathway you could take? Just simple exposure, going back to where we started, to what health data science is.
Well, and I think, I think the literacy part of it is the conversation, is how we introduce it. And I think you can even have that conversation with elementary school students. I mean, of start. So, one of the components, as we know, and it's part of that data science paper, is on health literacy. And so we have a unit where we talk about what is misinformation, what is disinformation, but then we talk about what is what's the difference between data literacy and health literacy. Knowing something about your health and how to get access to your record. I mean, that's a part of it. So that's a conversation you can even have with a younger student, if because everything's about mental health and being healthy and taking care of yourself. And so if you can integrate that into, oh, well, we need to help take care of our parents and our grandma. And, if grandma's got diabetes, does she, know what her A1C is, or does she know maybe what her blood sugars are? And how can we help her track that? And, that's a conversation you could have with one of the things I have learned is you can't get into going, we work in medical records and we make sure no one, improperly accesses your information. And we make,
Can't
nobody
be
cares.
abstract.
You
Can't be
can't be
abstract.
talking about we code your medical record and because then people go, well, my bill was wrong, and that so we even talked. I've talked to some middle school kids, Seth, and what we did is we went in and said, how do we know there's a especially now with the COVID, how do we know there's a pandemic? And they go, well, the doctors know. Well, how do all the doctors talk to each other? Like, how does it end up on the news? And they've never thought about it. And so then you back them into, well, do you
That's
know that
good.
we collect data? We have a standard language that we use to collect this data, and it's called us, and you can, I had that conversation at that science teachers conference, and one of the people went, so everybody in the world has this data. And I said, yeah, I said, it's for morbidity and mortality reporting. And we've been doing it a long time. And then we've modified it in the United States and we've used it for reimbursement. But that's not, and you can then have that conversation with someone. It's
Good.
almost like you by not by accident. I mean, I've been doing this a long time, so
Good.
I've had many airplane conversations with people where they'll start out, well, what do you do? And I'll say, oh, I teach in the medical school. Oh, really? Yeah, I teach in the medical center. What do you teach? Well, we teach and you just sort of figure
Those
out.
airplane conversations are fun because I'm an
Right.
aisle seat person, so I've got you trapped for at least 30 minutes when you sit in that window seat, and we're going to talk. I appreciate that you have headphones on, but we're going to talk regardless, and that's the
Right.
strategy. Well, as one quick question here is, how do we move the HI profession into more data science roles and get the establishment of our folks to understand we are data scientists?
Yeah, and I think we've, like I said, if we could figure that out, we would be running the place, but maybe we should, and I'm not saying it's like us. I'm not saying we need to all change our name, but I think we need to start using this terminology.
Yeah.
We need to use health data science or if somebody, but we need to use it so when people start searching for this information, we pop up, as an authority and as a source because with this mandate going out and, science teachers are now going, what is data science? How do we teach it? And, and being able to show, I think, we can show them what data science is in healthcare. I mean,
Yeah.
we're there, we're doing it. It's not a stretch. But I think maybe, part of it is just educating our members of, this is the terminology that's being used. And like you said, we're trying to create a pathway where students see us as an option.
Yeah.
Because on the other side of it, when you show them, and, like at the presentation, one of the people said, well, can they get jobs? And I said, I said, do you have internet? And she said, yeah. I said, get on LinkedIn Learning. I mean, get on LinkedIn and type in, I said, just type in health information jobs. And so she did, and all these jobs came up. She's like, oh my gosh, this job pays, whatever it did. And she goes, these are really good jobs. I said, I know. And nobody, these kids don't know they're an option. And
Yeah.
so just having these conversations I think with teachers and like I said, I mean, we've got free content that we've developed that I've got voiceover PowerPoints where we talk about what is health data literacy, what does it mean, how do you access your patient portal? We have exercises that we're doing with these high school kids where it's like, okay, if you had an encounter anywhere, go find out about the portal, or if your grandma's been in the hospital, you know, go find out about the portal. And it's very interesting because these most of these kids, they don't even know what kind of insurance they have. They've been to a doctor, but they fortunately haven't been really sick. And so they've never thought about really the healthcare system and the need to access data
Well, the health
and
literacy piece, especially with kids, has really sparked my mind because we have so many immigrant populations to where the grandparent or even the parent's not a first language
Yeah.
English speaker, and the kid becomes the
translator.
translator in between. And if we could help that kid out and say, here's what health literacy is, here's what it is, here's the resources that you can utilize as you care for your family in this environment. I mean, that elevates it even more, and it exposes that kid that's in school trying to better their
Right.
lives and do whatnot, and see a pathway for themselves that could be pretty fascinating. I like the fact that we should mirror the language of what's happening in K through
Absolutely.
12, because that's crucial. I like the term health data scientist better than I do informaticist. That's
Me too.
a hard one for me to even spell, let
Well,
alone
and it does,
say.
yeah, and and outside of our field, it doesn't mean anything. I mean, just like I use the word, and I use the word health data analytics a lot, because analytics means something to somebody that
Yeah.
may not be in the field. And so, yeah, I mean, it's, yeah, I just started saying we're data science, we're data. So, and at first I was kind of like, are we data science?
We
And
absolutely
because
are data
and
science.
and then when you really look at it, and then when
Yes.
you look at that white paper and you go, yes, yes, we are data science in healthcare. And they
Mm.
can and so I think using that terminology and sharing that with these teachers that are going to be struggling, because they're all, yeah, I mean, they were like, oh my gosh, I never thought about this, or, just, just showing them different data visualizations and how you use data to tell a story, is, I mean, we were worried that our exercises were going to be too elementary, but we've got some just really basic stuff. It's probably like what you would teach for HIM at associate degree level. We've got some really small data sets in Excel, and then we show them how you can answer questions with it, and it's related. It's some data related to microbiology, because we're
Mm.
trying with what we're trying to do with our grant. We're trying to link it with the lab folks to say, here are the back here are the behind the scenes people that do a lot of work that you don't even ever see and know exists. So
Which is important, because
mhm,
what you're saying in this project alone, you're saying that us, health information, health informatics, health data science, there is a whole side of the information, clinical information, that matters, that explains the story of what's happening here in the lab clinically, and this is a
mhm,
way to ferret out, what does this mean, how do we respond to it. And so you, as a health, I don't know if any students are watching this, or potential students, but if you are looking for a way to make population health impact, or even individual level impact for
yeah,
someone's outcomes in health, for them to be better or healthier, you don't have to be the clinician to do that. You can
right,
be the content manager, the life cycle manager of that data, and help explain that story and make it make sense to a person who otherwise would not understand. I love this conversation. Seth, would you do me, as we wrap up, would you be sure to include the link to that white paper
Yeah, we'll put it
in
on social
the
post.
post?
Yeah.
Okay,
Hmm.
yeah, because that's great. I want, if you're listening to this on something
mhm,
besides LinkedIn, go to LinkedIn, find HIPcast, and look at you'll be able to find the link to the study here,
Yeah.
because it's really incredible. So Rebecca, thank you so much. Thank you. This was so good, and I actually now am inspired to. I mean, I'm always talking to my grandchildren about solving problems and things, because my granddaughter, I think she always wants to know how to figure things out,
mhm.
and her brother's happy to let her figure them out, and he wants to then do the adventure with her, like
Yeah, yeah.
anyway. But I'm inspired by this conversation to expose them. I bet if we look at this, we've said expose at least a half a dozen times, but I
Yeah.
want to
You
expose
have.
them to the data science language around what we do. And I think I'm going to start trying to explain differently what we do. What do I do as a professional? What is it that I do sitting at my desk and my computer? And when I'm on these meetings,
Right,
what is it I'm talking about, and why does it matter?
right.
I really want to change how I talk with them about what we do. It's
Yeah,
awesome.
because we can't, I mean, you know, we can have conversations with younger students, with younger, not students, but just younger people. And so, as we always say, and some, if you get a chance to go to a career day, if you get a chance to go talk to a club or a group that your kids are involved in, or your grandkids are, I mean, those are good opportunities. I mean, I feel like we always say we're planting a seed, but you just never know when
Yeah.
one day maybe that's going to spark somebody.
Yeah.
And the other thing I try to tell people is you can work in healthcare and you can potentially work remote. You can work a more 9 to 5 schedule. There's so many advantages, value adds to work-life balance that we have when burnout is such a big issue for our clinical friends and colleagues that, that's some, it's just a really, just look at the diversity of the jobs and the things that people do. And it
We're the
really
best.
opens.
Let's just throw it out there. Health information's the best. We'll just throw it out there and say that statement that it's there. But this has been a great conversation. I will include that link to in our social post and in the description. So, Dr. Reynolds, thank you for joining us today. It's been a great conversation.
I could talk about this all day, as you know. So,
hey, let me add one thing before we close out. I was talking about my granddaughter wants to figure it out, and then her little brother wants to go on the adventure. This is what they told me once. Callaway is going to build an airplane, and Chance is going to fly it, and they're going to fly to the cruise. So
I like it.
It is exactly
good for them.
Exactly how it is. So anyway, this was great, Seth. Thank you for bringing this, adding that link, and Rebecca, thank you for bringing this to us. Let's encourage even younger folks to get into our profession. We'll see you soon.
That's right. All right, Shannon. Until next time, my friend.
Bye-bye.